Medicaid means more than health care for people with disabilities. It also means the freedom to live at home with support, to work, and to participate in community life. Threats to the current Medicaid system could change all this. Here's why.
Hi, my name is Stacey Milbern. I live in Oakland, California. I'm 29 years old. I work in HR in the private sector. I'm originally from North Carolina, but the town that I grew up in wasn't very accessible, and my independence was fairly limited. There was a point where I realized one day I hadn't left the house in like 3 months and that I was really depressed. So I feel really lucky to be here in the Bay and being involved in disability communities. So I have an MBA from Mills College, and before that I've studied political science, and I've always been really interested in social justice issues. Through the Medicaid buy-in program, I am actually able to access 24-hour attendant and nursing services. So I have about 40 hours of private duty nursing, and they come and make sure that I'm doing well health-wise and help me manage some of the medical side of my disability. I was actually sick last year and in the ICU for like 2 months, and their support is a big reason why I was able to come back to my own home and not a nursing home. In addition to those 40 hours of nursing support a week, I also have attendants. So when I wake up in the morning, my attendants assist me in getting out of bed. They help me make breakfast and prepare for work. They come during lunch to assist me during lunch breaks. At the end of the day, I leave work and I meet friends for maybe a movie or other things. And my attendants go with me. A lot of times they drive in my car and then come home, and my attendants assist me in doing evening routine and getting into bed. So my whole life is made possible because of these attendant supports. Without them, I wouldn't be able to live independently, let alone in the community. It's very easy for someone with my disability to wind up in an institution forgotten if these services do not exist. With support, I'm able to live a really active lifestyle, so I really enjoy hiking and barbecuing and ice skating and things like that. My ability to work every day depends on my ability to get up and about and out in the world. And if I'm not able to do that, then I don't anticipate that I could continue working. If Medicaid supports were cut and I no longer had attendant services, I likely would be living in an acute care facility. So that's a facility where there are nurses, and it's very much an institutional setting and not my own home. It's taken so much work to put these programs into place, and the idea that we could roll them back so quickly is truly terrifying.
People like Stacey could lose life-saving Medicaid home care if Congress repeals the ACA or changes the program to block grants or caps care. Act now. Tell your members of Congress no changes to the ACA or Medicaid. 202-224-3121.